Hey everyone, and welcome back to Stewart Physical Therapy YouTube channel. I'm Britt. I'm your pelvic floor physical therapist, and I specialize in women's health here at our High Point location. I wanted to introduce myself first and just walk you through what to expect for your first visit here to help calm any nerves and to answer any questions that you might have before you come in. Let's start with just the first big question: what even is pelvic floor physical therapy? I like to tell patients that I am a doctor of physical therapy first and a pelvic floor physical therapist second. I did specialize after I got my degree, and that just means that I like to take a full body approach. On your first visit, I'm not just looking at your pelvic floor. I'm going to take a entire body approach at how your body moves. This is going to be things like how you breathe, how everything is contributing to your symptoms. All right, so let's just start with your first visit is really centered around a conversation. So when you get here, we're going to take a deeper dive into your medical history, your current and your past symptoms, and I really like to look at those symptoms and how they're affecting your daily life. I'm going to ask questions about your bladder, about your bowel health, about your sexual health, and I'm even going to go into things like your diet. I like to fully understand everything that's going on. I like to know topics that can be very personal, and a lot of people that come to me do have a history of trauma. I want you to know that this is a safe place, and I like to be very supportive, and it's a completely judgment-free zone. Okay, so from there, we're going to move into a full body assessment, and then this assessment is going to include, this is where your breathing pattern, your posture, I'm going to look at your core strength, your hip strength, and how you move. This often is going to depend on also your goals and your activity level. So if you're someone who performs at a little bit of a higher level, if you're someone who likes to go on runs, if you're someone who competes, I'll look at that and take it into consideration. If you're one of my pregnant mamas, I'm obviously going to take that into consideration as well. It really just depends on who you are as a person and how your body is working as a whole. Okay, so this is a really big question that I get a lot, so I want to, part of calming the nerves is answer this one up front. On the first visit in the High Point location, I am going to take a focus on the external assessment only. If an internal pelvic floor assessment is something that we decide would be helpful, I never really conduct one on the first visit. We would talk through this together, and we'd only really move forward with one at a later session once you feel more comfortable and ready to do so. I'm always going to be here for you at your level, and you are always going to be in control of what we do. Education is also something that is really important to me. I like to help you know off the bat from your first visit what is happening to your body and the anatomy and the function of your pelvic floor so that you can better understand what's going on and your symptoms. Because the pelvic floor does not work in isolation, it works with your entire body, your breathing, your posture, your hips. I will show you the model in person. We'll show you how the organs work in tandem with your muscles, with the sexual function, with the bowel function, with everything that might be going on, depending on why it is that you're coming to see me. I have physical models in the office so that we can go through them together. My goal is to meet you exactly where you are. We'll work together to create a plan of care, to set goals that are meaningful to you, whether that is returning to exercise, improving your symptoms, or honestly just to feel more confident in your body. I also do work a lot with pregnant and postpartum patients and mothers, so I do know that life can be pretty busy. So in the need that you might have your baby with you or you have any special accommodations, please feel free to reach out to our office ahead of time, and we'll try our best to help you. As far as what to wear, please just come dressed in whatever makes you feel the most comfortable. There is no special outfit required. So that is what you can expect from your first pelvic floor physical therapy visit here in High Point. My goal is to help you feel the most comfortable, heard, and supported from the very beginning. Please remember to arrive about 15 to 20 minutes before your appointment to complete the new patient paperwork, unless you have actually obtained it beforehand and completed it before you arrive. If you do have any questions before you arrive to your visit, please don't hesitate to reach out, and I look forward to working with you.